The advancement in science and technology has consistently revolutionized healthcare delivery globally. Medical procedures that seemed almost impossible to carry out years ago are being performed with little or no stress today. In 2002, the treatment method of uterine fibroid, a disease common in women, especially black women, was given a major boost with the introduction of the HIFU technology. And just recently, the HIFU machine was brought into Nigeria, in fact, the first of its kind in the West African region by the Uterine Fibroids Care Center, a fertility clinic based in Lagos and Abuja. Dr. Bayomi Ajayi is a gynecologist and fertility expert. He's also the founder of Uterine Fibroids Care Center.
HIFU is high-intensity focused ultrasound and is a non-invasive method of treating uterine fibroids and adenomyosis. Conventionally, we've been treating fibroids by using surgery. Either we do what we call mammectomy or hysterectomy. Mammectomy means taking out the fibroids, leaving the uterus behind. Hysterectomy means taking out the whole uterus. And the only cure for fibroids is actually to take out the uterus. But even with that, there's still some risk. What are the risks? We know blood loss is a major problem. Or you could have what we call deep vein thrombosis, which because of the fact that the compression in the pelvis, and after the surgery you have to wait for about a week or so, you're on the bed those days. So that caused a lot of death. And not to talk of anesthetic risk as well, which so many women also had from mammectomy. With this HIFU now, it takes away almost all the risk because we don't cut at all. We don't use anesthesia. We just sedate a little bit. The whole procedure lasts for about 2 hours. You rest for another 2 hours, you are good to go home.
The HIFU is a non-invasive method of treatment with a very high success rate. Dr. Bayomi Ajayi speaks again.
It's targeted treatment. We're converting ultrasound to heat energy in the machine. So once we can identify the fibroids, we choose where we want to start. And what the machine does is like it cuts the fibroids into slices, just like you're slicing yam. And then it fries them slice by slice, by the doctor just changing the direction of where the heat is delivered and so on.
Although the HIFU offers great hope for persons with uterine fibroid, it is, however, not recommended for every fibroid patient, as Dr. Bayomi explains.
There are some people who cannot touch it at all. If you cannot communicate, you cannot touch it at all because you need to be able to talk to the doctor. If also you cannot lie down for about 2 hours, either you have a skeletal problem that can't make you to lie down still, then you cannot do HIFU. Those are absolute contraindications. There are some relative contraindications. Relative contraindications will include obesity. We try to use the cutoff mark of 120 kg, but that does not mean that you cannot do it, but we have to be sure that you can do it because you know where is ultrasound. Between where the ultrasound beam or probe is and where the energy is delivered is about 12 cm. So imagine if your abdominal fat is 8, that means effective distance that we have is just 4. So the lower the thickness of your abdominal girth, the better you are because you have the more the distance that the energy can travel through. So if you are 4, that means you have about 8 cm that we can use. So that's for people who are grossly obese. Also, if you've had a scar, for example, people who have had abdominal liposuction, we can't take them because there will be distortion of the anatomy. But if you have had a scar, ordinary, like you've had a surgery, if it's the up and down, we can look at you, do what we call a simulation to see that we can have a safe pathway to pass through.
You've been listening to Health Corner on Voice of Nigeria.